My job as a specialist physiotherapist is to support patients with non-alcohol related fatty liver disease to become more active. So that may be through increasing day-to-day physical activity, or it may be through structured exercise programs. Currently, there are no drug treatments to treat NAFLD, so the main treatment is lifestyle behaviour change. So the main things to think about are losing weight, dietary change, and becoming more physically active or exercising. The guidelines for exercise for patients with NAFLD are 150 minutes of moderate intensity aerobic exercise. So aerobic exercise is the type of exercise that increases the fitness of your heart and lungs, and it includes things like brisk walking, swimming, or even going for a jog. Moderate intensity exercise should make you feel warmer, it should make your breathing feel heavier, it should make your heart beat stronger. You should be able to speak, but you shouldn't be able to hold a full conversation, and that's a good way of gauging whether you're working hard enough. The other recommendation is that you carry out resistance exercises, so that's strength training exercises, and these exercises are designed to build up the strength in your muscles, and we recommend that you do those on 2 days a week. And this includes things like lifting weights, carrying shopping bags, using your body weight, so doing things like press-ups against a wall. They would all be strengthening type exercises. Now, if this sounds too much for you at the moment, then break this down. 10-minute exercise bouts count towards this 150 minutes. So you can do lots of small bouts and add these up over the course of the week if that's more achievable for you at the moment. The other thing to think about is just trying to reduce the amount of time you spend sitting, and this also has really important health benefits. So not just reducing the total time that you sit all day, but trying to break up your sitting time so that every half an hour or so you're having a stand up and maybe a walk around the house. So try and plan that into your evening if you're sitting for long periods of time, or plan it into your working day if you're sitting at the computer for long periods of time. If you suffer with fatigue or tiredness, or you have other comorbidities that make exercise and physical activity difficult, there are different options of physical activity and exercise out there. You could try chair-based exercise as a good starting point, or try something like yoga or Pilates that's a little bit more gentle. But a lot of it is about starting gradually and building up from where your starting point is, and just taking into consideration what you can manage. With exercise, one size doesn't fit all. So if you try something and you don't like it, don't beat yourself up about it. Try something else, or maybe try less of it. So don't give up trying at the first attempt. It's really about trying different things and finding something that you enjoy and are willing to take up in the longer term. My top tip would be to think about what you do at the moment and have a think about the opportunities within your day-to-day lifestyle that you could become more active. So it's not going to be the same for everyone. And think about things that you'd like to try. And when you find something and you enjoy, then try and stick with it. If you can find someone to do it with, that's really, really helpful to keep you on track in the longer term. So a physical activity or an exercise buddy is a really good thing to have. The internet can be a minefield of misinformation, so some trusted websites to have a look at as a first port of call would be the NHS website, the British Liver Trust. Sport England has really good information about physical activity and exercise, so they're good starting points. And if you need further information on that, then speak to your clinical team, and they can often signpost you to something a bit more specific and a bit more tailored to your needs. Making lifestyle changes isn't easy. You're trying to change habits that you've built up over a lot of years. So be proud that you're actually willing to try and willing to make some of these changes. And some things will work, some things won't work, but those things that don't work, it's not a failure. It's you learning about what works for you personally, and different things will work for different people. So it is a long journey that you're going to be going on, but be proud that you're actually starting this journey and that you're willing to make these changes.